Welcome to Chapter 8, Water and Minerals. Osteoporosis by Professor Tammy. Learning objectives. Discuss how osteoporosis develops and the actions that may help to prevent it. Calcium absorption from food sources. Calcium and vitamin D are important bone strength in later life, so you want to take care of yourself. Bone building during childhood and adolescence, so that's when you really need to make sure you have a good amount of calcium. Protein, research results are mixed. Sodium soft drinks, high sodium intake links with high urinary calcium excretion. So the more soft drinks you consume, the more calcium kind of leaves your body through urine. And also vitamin K is good. All right, let's look at this chart here. So these foods have 50% or more absorption of calcium. And these foods have about 30% absorption of calcium. These foods have about 20% absorption of calcium. And these foods have 5% or less absorption of calcium. So it's really interesting how some foods you absorb calcium much better than others. You would think that milk and milk-related products would probably be on the top, but it seems like a lot of leafy greens, broccoli, that family, you absorb the calcium much better there. Development of osteoporosis. The bones, trabecular, is tapped when blood calcium is low. Cortical becomes more porous and thin. So there's also bone loss, the dowager's hump. So this is a person, regular standing, and then they have a hump. And it's not because she didn't stand up straight, it's because of the calcium and the osteoporosis. Bone loss can also cause fractures and common sites too. If you look, someone who's 50 and someone who is 80, as we get older, we get shorter. Each year, just a bit shorter. So over 30 years, you become about 6 inches shorter. So let's look. So about half an inch per year. Loss of trabecular bone. If you look at this, this is the normal bone, and this is when the bone loses the trabecular bone. So you see how much bigger the holes are versus here. There's a lot more holes. Risk factors for osteoporosis. Something you can't change, so it's non-modifiable, is female gender, older age, small frame, Caucasian, Asian, Hispanic, Latino heritage, family history of osteoporosis or fractures, personal history of fractures, estrogen deficiency in women, the lack of menstruation or menopause, especially early or surgically induced, and testosterone deficiency in men. Something you can change, which is modifiable. Sedentary life, you want to become more active. Diet inadequate in calcium and vitamin D, so you want to increase your consumption of calcium and vitamin D. Diet excess in protein, like sodium and caffeine. Cigarette smoking, you want to decrease that. Alcohol abuse, drink less alcohol, or just don't drink as much. Low body weight, certain medications such as glucocorticoids and anticoagulants, and diet low in fruits and vegetables. 2 women's bone mass history compared. So, woman A and woman B. So when you look at woman A, she has a higher peak bone mass. So as she ages, even though her calcium is decreasing, it's still not in the red danger zone like woman B is. So if you start out with more calcium in your bone, as your later years, you won't hit the danger zone or even be at risk for osteoporosis like here. So there are different ways of kind of looking at your bone mass density, like the DEXA scan is a highly expensive machine, drug therapies, and estrogen replacement therapy. Calcium intakes. Recommended amount varies with life stages. So it depends if you're a child, infant, pregnant women, lactating, 20s, 30s, 50s, 60s. The amount of calcium you need varies within the stage of life you are experiencing right now and in the past and future. So, as far as sources of calcium, you want to get it from foods and beverages first. So you want to get from your diet, like a dietary calcium, like from milk, yogurt, cheese, and green leafy vegetables. And vitamin D you can get from sunshine because your body would synthesize it. Remember, when you're lighter skin, your body synthesizes vitamin D faster than if you were darker skin. And if you're darker skin, you can stay in the sun longer than someone with lighter skin. Supplements. Supplements also have calcium. So they're also good sources of calcium. So a lifetime plan for healthy bones. So we'll go over these life stages. Let's start with the note. The exact ages of succession of bone accretion and onset of loss vary among people, but in general, data indicate that the skeleton continues to accrete mass for approximately 10 years after adult height is achieved and begins to lose bone around age 35. Children 2 through 12 years old. What's happening is the goal is to grow strong bones. The plan is to use milk as the primary beverage to meet the needs for calcium with a balanced diet that provides all nutrients. Play actively in sports and other activities. Limit television and other sedentary entertainment. Do not start smoking, tobacco, or drinking alcohol. Adolescents through age 13 through 30. The goal is to achieve peak bone mass. The plan is to choose milk as the primary beverage. If milk causes distress, including other calcium sources, commit to a long life program of physical activity. Do not smoke tobacco or drink alcohol if you have started. Quit. Mature adult, 31 through 50 years old. Goal, maximum bone retention. The plan is to continue as for 30 to 30 years old. Adopt bone strengthening exercise like strength exercises. Obtain the recommended amount of calcium from food. Take calcium supplements only if calcium needs cannot be met through foods. Mature adult, 51 years and above. The goal is to minimize bone loss. The plan is continue as for 13 to 30 years old. Continue striving to meet the calcium and need from diet. Continue bone strengthening exercises. Obtain the bone density test. Follow physician's advice concerning bones restoring medication and supplements. See you soon. And remember to read the book.